Assalamu alaikum wa rahmatullah. Welcome to a new episode of our program Family Time. Actually, we have the concerns with the family affairs, healthcare, lifestyle, and the educational affairs. But today we have something very important. We will speak about the gate to the body, or the entrance to our body is the skin, our skin. How to have a healthy skin and how to have a healthy skin care. That is what we are going to be introduced to with my guest today. She is a consultant dermatologist, and I'd like to tell you something about our skin. Of course, you know that how much is it important to have the care to give our body or our skin more care than the other organs, because you know that the skin is the outer surface that faces the sun or the the water, every possible mean and impossible mean that can damage or harm or cause the usage of the body can come through our skin. But for today, we have some tips for the people to go out from the, or to prevent them from the breakouts and clear them up as fast as possible. You can wash your face twice daily with warm water, okay, and mild soap made for the people with acne. Also, don't pop pimples. Avoid touching your face with your fingers, because sometimes you have some of the bacteria in the fingers or between the nails and the fingers, so it can cause, sometimes you have inflammations in our skin, maybe for the face or some in other place, so you can cause infection to this clear area. So you have to take care of itching your face or touching your face with your fingers. Maybe they're not that clear. If you wear glasses or sunglasses, make sure to clean them frequently, okay, to keep oil from clogging the pores and around your eyes and the nose. If you get an acne on your body, try not to wear tight clothes. This will cause you harm. Remove your makeup before you go to sleep. This is for women and for girls. Sometimes we use, because of the noisiness of the life, and because we are always in a hurry, sometimes we can just come from outside without washing our face from the remains from the makeup. So this is very important to clean our face immediately while coming back home and before sleeping. This can cause harm to our skin. Keep hair clean and out of your face to prevent additional dirt and oil from clogging your pores, and protect your skin from the sun. And it's very important to protect your skin from the sun, and especially this sunny weather here in Saudi Arabia. We have so many dangerous diseases can be caused by the sunbeams. Now I guess that I said what I have till now. Let us go through a short report to be introduced more to the diseases that can attack our skin, and what are these diseases, what are the causes and the main factors that are causing them. Waiting for you, inshallah, I will have my guest with me. She is doctor. I'll leave it as a surprise until you come back to me. Waiting for you. Stay tuned with me.
Eczema can mean a family of skin conditions that causes the skin to become swollen, irritated, and itchy. Many skin conditions are considered a type of eczema. Eczema is a general term for rash-like skin conditions. The most common type of eczema is called atopic dermatitis, which is an allergic reaction. Eczema is often very itchy, and when you scratch it, the skin becomes red and inflamed. Eczema affects adults and children, but it is most common in babies. Although the exact cause is still unknown, yet eczema is not contagious. You are more likely to have eczema if you have a family history of the condition. And it can't be cured, but it can be managed. You can also learn to avoid things that trigger it.
There is a lot of conditions, and the causes are vague. That's why we want to categorize them. At first, there is the infantile eczema or the atopic dermatitis. This atopic dermatitis, it is usually hereditary in origin. It occurs in a group of members of the family. Usually it starts within the age of the first year of life. It's up to 5 or 6 years. 65% of cases will be under 1 year, and 95% of all cases will be under 5 years. It's also more common during adolescence.
Sometimes eczema can be easy to diagnose, but a challenge to treat. Teaming up with a dermatologist can help. If there are telltale signs that this is an allergic reaction, your dermatologist may order a test called the patch test. Some means of preventing eczema includes limiting your contact with things that can irritate your skin, wearing gloves to protect the skin on your hands, wearing clothes made of cotton or a cotton blend, caring for your skin in the bath or shower, and avoiding scratching or rubbing the itchy area.
There is some medications which may help to relieve. At first, to relieve itching by giving some medicine like antihistaminics. There is a new safe long-acting antihistaminics. They don't lead to drowsiness or sleepiness of the baby. The second thing is to reduce the inflammation. And this is here we are using topical corticosteroids. Started since 1951, these drugs. But now there is very safe drugs to be used. For the mothers don't afraid to use. Also, they have to use some lotions or creams or ointments or pastes which will lead to removal of the scales, and also to do skin barrier, because the main cause is that the skin is dry and cold. That's why it's liable for dermatitis. And this is the main medications for this type. Sometimes there is trials for severe and prolonged cases with ultraviolet rays. This is a trial. There are some vitamins to be added, like vitamin E, vitamin B6, and other vitamins. Also, this is trials around the condition, but it is a hereditary condition.
A lot of people fear eczema, thinking that it could be in any way contagious. However, the truth is, and according to medics, it is nowhere near danger, and it is very common and natural to take place because it's only a skin disease that goes by time and with prevention.
Welcome back after showing this report, and as if you've seen in the report was about the skin diseases like eczema, and it's one of the hardest skin diseases. As we've seen in the report, it's easy to be diagnosed, but it's a challenge to be treated. But let me first of all welcome my guest with me and introduce you to my guest. She is Dr. Zenus Saleh. She is a consultant dermatologist, and she will help us more to know or to be introduced more to the skin diseases that can attack our bodies. I'd like to welcome you, doctor, with me.
Thank you for welcoming me. Thank you.
I'd like to greet you for this marvelous name.
Thank you very much.
I love it so much.
Thank you very much. It's nice.
Doctor, I'd like to ask you first of all about the importance of skin. Some people are ignoring or neglecting the importance of their skin. They are saying that it's not something from our inside, so we can ignore it and we can just take care of the other organs that are inside.
Sure, the skin is actually the largest organ of the body, so it's enough to know this, to know the importance of the skin. Second, the skin is the mirror of the body.
Yes.
It's true that the other organs are very important. They are hidden inside, whereas the skin is the reflection of the body. It has many important activities, like, for example, it protects. It's a cover, like a cover for the
Yes.
whole body. It protects us from invading organisms. It protects us from the sun. It's also important for the synthesis of vitamin D. although many people don't know that it is the primary organ synthesizing vitamin D in the body. It also prevents the body and the internal organs from dehydration, and this is very important because without the skin we would lose our water and we will not be able to survive on the surface of the earth. So it's a misconception that the skin is not important. It has many important roles.
So what can you tell us about the layers of the skin? Do we have just this outer layer of the skin on just covers our body, or we have something more sophisticated than that?
The skin is actually composed of two layers. The first layer that we see is called the epidermis. This is the outermost surface.
Epidermis.
The epidermis, right.
Yes.
This is the outermost surface of the skin. It is composed of living cells called keratinocytes.
Yes.
And this is the layer of the skin which regenerates on monthly basis.
Yeah.
But hidden inside, underneath this epidermis, we have the dermis. This is the layer which gives the skin its thickness, because it is made of collagen. Maybe you have heard this term before. Collagen is the main constituent of the dermis, which gives the thickness of the skin. It's also made of other fibers and of ground substance called hyaluronic acid. This part, the dermis, is a very important layer which is very thick in youth usually, but which loses its thickness with age. And it contains many important appendages like the hair, for example, the sweat glands, the nerve receptors. So these are the two main layers of the skin, the epidermis, and then underneath there is the dermis.
So that's perfect. So when we have a skin problem, of course, most of us, sometimes we are having we feel that we want to itch, or sometimes we want to make something, like without itching. Sometimes we have some red scales or some scars in our bodies, but we do not give them the same concern with the other, actually with the other symptoms that can attack our other organs. But how can we diagnose the skin diseases or the skin problems?
Actually, itching is a very important symptom when a patient comes to us complaining of itching. This might be due to several causes, but this by itself is an indicator that your skin is not healthy.
Yeah.
Itching is usually a reflection of a dry skin. Dry skin usually causes itching. It makes the person need to scratch all the time.
Yes.
And this means that the person is not taking good care of his skin, he's not moisturizing his skin enough, and this with time would lead to a very important disease that is called eczema or atopic dermatitis.
So you came to an important one about eczema. What is the story of this disease?
This is a disease that affects all age groups. It is a disease which is very frequent, especially in the dry countries like here in Saudi Arabia. It is a disease which causes itching. The cause of this disease
is it infectious?
It's not infectious, it's not contagious. Usually the person has a dry skin, and this dryness might be due to several causes. One of the causes is the dryness of the weather. Another cause is bad habits that he has at home. For example, if he washes his skin with the hot water, this causes dryness. If he uses antiseptic soaps, this also causes dryness. If he doesn't use enough moisturizers, creams, and lotions, this also causes dryness.
Hygienes too?
No, usually hygiene, on the contrary, sometimes excess hygiene and excess water and soap use might lead to irritation in the skin. And
irritation.
This might irritate the skin, and with time, this would lead to eczema. So no, it doesn't have to do with hygiene, but it is usually lack of hydration and lack of moisturization of the skin.
Yeah, lack of hydration and moisturization to the skin. So I saw the pics for the people with eczema, but I don't know what about the symptoms.
The symptoms, usually the patient comes complaining either of itching or of scaling. He sees like white flakes on the skin.
Yes.
Or a very frequent symptom is redness. On the
Redness.
skin. He sees red patches on the skin.
Uh-huh.
Usually the patient misdiagnoses this or comes complaining of fungal infection. He doesn't know that this is eczema. He
Yeah.
might say this is allergy. But usually when we have these symptoms, itching with redness and flaking on the surface of the skin, this is pretty much eczema.
So eczema it can be easily diagnosed rather than any other skin disease. Is it clear to the doctors to see that it's a case of eczema or any other type of inflammation, skin inflammation?
Usually for a dermatologist, usually it's a clear-cut diagnosis, so it's not really that hard. But of course, we have diseases that come with different forms, so eczema might also be, it might be a misleader, so we might think it is something else, but we usually can tell this is eczema in 90% of the cases just by
90%.
clinical exam. So just by seeing the patient, especially that eczema usually affects very common sites, like for example the flexures, the neck, the underarms.
Yeah, that's what my question. Yes, the common areas of the body that can be easily affected by the eczema.
Usually they are the flexures, as I told you. They are the sites where you have skin coming on contact with the skin, in contact with the skin. Like for example the neck, where you have the redundancy of skin, like the underarms, the flexures. Of course the eyelids are very sensitive, and this is also an area for eczema. But of course any other area in the body can become affected with eczema.
But there's something confusing here. You said that between the neck and when there are two areas of the skin are contacted with each other, sometimes this makes like moisturizing. So we're saying that it comes from the dryness.
No, not necessarily. When you have skin coming in contact with skin, on the contrary, this causes more irritation for the skin, and the friction by itself is harmful for the skin. It's as if you are rubbing the skin. So no, it doesn't lead to more hydration of the skin. The water on the surface of the skin would come from the secretions of the skin itself.
Yes, that's right. So do we have certain types of eczema, or it's just one type?
We do have many types of eczema. The most common type is the atopic dermatitis, what we call atopic dermatitis.
Atopic?
Yeah, this is what we basically have been talking about till now. This is caused by the dryness of the skin. But of course we have other types of eczema, like for example contact eczema, which is an allergy or a reaction to any contactant that comes on the surface of the skin. We have this hydrotic eczema. This is a form of hand eczema which usually affects the hands, but it is due to like water coming underneath the skin or being trapped under the skin. So, but the most common type is atopic eczema or eczema.
Are they all sharing the same symptoms, or there are some different symptoms for each one of them?
Usually all patients come complaining of redness and itching. So basically, yes, they share the same symptoms, but again, it's the role of the doctor here to tell which type of eczema we are dealing with. Like for example, when the patient comes with hand eczema, this is most likely going to be a contact eczema or hand eczema from frequent washing of the hands and frequent work with detergents, like for the housewives, etc. When the patient, for example, has eyelid eczema, this might be from a new makeup that she is using. When she has allergy, for example, behind the ears, it might be from a perfume, or under the arms, it might be also from a perfume. So we have really to dig in the history, not just take it straightforward that this is atopic eczema. But when we see on the skin that it is that the skin of the patient is dry, it's more likely to be atopic or dry skin eczema.
So how can we treat eczema and the dead time to be treated completely?
Unfortunately, there is no complete cure for eczema.
No complete cure?
No, there is no 100% cure for eczema. And this is what the patient and every person has to know, because patients come to us, they have been suffering from this problem for years, and they are fed up with this problem.
Yes.
They don't want to apply creams anymore. Unfortunately, there is no cure. It's like any other disease. Once you start having it, you have to keep taking care of it.
Yes.
Of course, there are treatments during the attacks. For example, when the patient comes with the redness and with the itching, the most common treatment that we use is topical steroids or the cortisone creams. These are very effective. They give fast results, but the patient cannot keep using them for a very long time because they have their own side effects. Of course, the treatment is not only limited to the episode, to treatment of the episode with the cortisone creams. The patient has also to keep using moisturizers on daily basis, because this is basically the cause of the disease. So he doesn't have only to treat the disease right now, but he has to prevent it using the moisturizers on daily basis. This disease will keep coming back if the patient keeps getting exposed to dry skin, like to dry weather, for example, like here in Riyadh. The weather is very dry, and so this is very likely to come back in a seasonal way, or whenever he is exposed to dry. Yeah, sure. This is why I'm saying that it's not a cure. It's not curative.
That's
completely.
Right. Actually, I'm so attracted to your speech, doctor, about the skin diseases, and especially about this eczema. But now it's time to go through a short report to know more also about some other skin diseases. Stay tuned with me and with my guest, Dr. Zenus Saleh. She is a consultant dermatologist, waiting for you to come back to us in the studio.
Many of us pay a lot of attention to the way our skin looks like, as it is one of the fundamental contributing factors to good physical appearance. But skin also has other biological functions, such as acting as a protection from the environment and as a barrier for fluids, as well as regulating temperature, detecting infections, and acting as a sensory organ to touch and movement.
Well, our skin is like a shield, and it's a barrier which protects our internal organs and our muscle from damage. And it's also our own organ that's exposed to the environment, so it's very important that we look after it.
Skin color is also a factor we give much importance to, which is why many people love spending hours under the sun. And if this is not available in cooler countries, many would resort to the popular tanning shops. The result of ultraviolet radiation does not only have potential terminal consequences, but can age the skin sooner, produce sunspots, broken blood vessels, and even eye cataracts.
Overexposure to UV rays is linked to the development of skin cancer, and in particular malignant melanoma is the most deadly form of skin cancer. Once it's contracted, and if it's not dealt with early, it can spread to other parts of the body and can frequently be fatal.
Special skin cells called melanocytes are responsible for producing the melanin and carrying it to the keratinocytes in the epidermis. The number and arrangement of melanin pigmentation, or melanosomes, not only determines our skin color, but also how protected we can be from the sun, which is why fairer people are at a higher risk of getting burnt and developing skin cancer than someone who is darker.
Everyone's got a different skin type. Generally speaking, people with fairer skin, or people with lots of freckles or moles, or with ginger-coloured hair, tend to be more at risk of developing skin cancer. That's because their skin tends to be paler, and they'll find that when they're outside in the sun, they'll burn quicker, and sunburn is a really high risk factor for skin cancer. So people with darker skin or with black skin tend to find that they can stay out in the sun longer without burning, but they still need to be careful because they still can develop skin cancer.
More than 70,000 new cases of skin cancer are diagnosed annually in the UK, with one person dying every 4 hours as a result of it. The best advice to protect oneself is to wear clothing covering the entire body, including a hat and sunglasses, and staying indoors between midday and the afternoon. A sunscreen that has a sun protection factor above 30, as well as a high UVA protection, is highly recommended.
The incidence of skin cancer has increased significantly in the past 25 years, but there's lots that people can do to help protect themselves from developing it. So the most important thing people can do is make sure they enjoy the sun safely and make sure they never get sunburnt. So that means staying out of the sun when it's at the highest in the middle of the day, trying to spend some time in the shade, covering up by wearing a wide brim hat and t-shirt, and using sunscreen and making sure that you apply it frequently and reapply it regularly.
The World Health Organization estimates that 20% of all blind people in the world is a consequence of ultraviolet radiation. Furthermore, there are around 4 million skin cancer cases diagnosed each year globally, and the problem is further aggravated with the depletion of the ozone layer and changing lifestyles.
Dear audience, welcome back to the studio. Our issue, we are discussing today the skin diseases and how to have a healthy skin care. With me in the studio, Dr. Zenus Saleh. She is a consultant dermatologist. Welcome back, doctor.
Thank you.
Doctor, we have seen in the report, we mentioned the skin cancer and how the sunlight is one of the factors that can support or help having this type of cancers.
Definitely, the sun is the most important factor causing skin cancers. The sun has two different or several different wavelengths. The ones that are of concern for us for the skin cancer is mainly UVB, which is ultraviolet B. The sun also sends ultraviolet A that also reaches the earth. But the one that's most important as far as skin cancer is concerned is called ultraviolet B. The role of this radiation is very detrimental on the skin cells, and with time it leads actually to skin cancers.
So does it kill the cells, or does it make like a disbalance between the cells, or unwanted or undesired movement for the cells?
Yeah, it affects the genetic material which is present inside the cells. It has an impact on the DNA inside the nucleus, and it leads to mitosis, which are changes occurring inside the cell itself, and this would lead to multiplication and replication of the cells, and this replication at some point becomes like out of control, and then this is a tumor, and when it starts invading, it's malignant, and this is a skin cancer basically.
So is the sun all the time harming, or sometimes the sunlight is just useful for the body? When to have the best usage of the sunlight and when to avoid it at all?
This is a very important question, Fanar, because the sun is not always dangerous, but it is the misuse, if you want, of the sun, which is leading to the skin problems due to the sun. The sun actually is very important for the synthesis of vitamin D, and without the sun we would not be able to synthesize the vitamin D on our skin. However, we should not take advantage of this and say that I would stay just in the sun the whole day.
Yes.
Of course. If you want to benefit from this, you can just take a 15-hour break in the sun in the afternoon, after 4 o'clock in the afternoon, or before
15 minutes, you mentioned?
Yeah, just 15 minutes are enough.
Yeah.
Or before 10 o'clock in the morning.
Yeah.
These are the periods of time when the sun is not really heavy, the sun rays are
not that burning.
It's not burning, and you would take the sun rays that are beneficial, and only 15 minutes are enough. You don't need more than
15 minutes early in the morning, before 10?
Yeah.
And some other 15 minutes before the dusk?
Yeah, that's it.
Or the sunset?
Yes.
So those are the 2 times daily we can get the best use of the sunlight, and during the day we have to avoid the sunlight.
Yeah, during the day it's better.
Especially here in Saudi Arabia, the weather is so sunny.
It's so sunny, and you feel that the sun rays are so heavy on your skin. During the midday, the sun rays that reach the earth are mostly the ones that are harmful, like these sun rays. They are mainly made of ultraviolet A, and they can lead to sunburns, they can lead to other diseases like pigmentation of the skin.
So how about the degrees of the sunburn for our skin?
Yeah, there are several degrees of the sunburn, and this depends on the severity of the sunburn, if you want. The mildest degree is the first degree sunburn. This is when the patient comes to us complaining of severe redness and itching, but it is affecting the whole area that was exposed to sun. Usually the skin is tender to touch.
Yes.
And the patient is not able to sleep. He's feeling hot all the time. This is first degree sunburn, and usually this will go away in like 2 or 3 days. It will resolve on its own.
With treatment? 3
The
days of treatment, or it can go away without any type of treatment or medications?
Usually the treatment is supportive, like to help the patient bear the pain and bear the itching.
Yes.
And the heat that he's feeling. But usually on its own, even if you leave it on its own, it would go away in a couple of days. We usually ask the patient to put cold compresses to stay in a cold area, just as supportive measures for his sunburn. But usually, even if left alone, it would go on its own.
So do we have a certain measurement or to have this sunburn after how many hours are necessary to have this sunburn?
I wish I could tell you. I could tell you. Unfortunately, this matter depends very much on the type of the skin. Like in dermatology, we divide the types of skin into 6 types. It depends on how fast they burn.
Yeah.
From 1 to 6. So 1 is the one that burns easily, and the 6. Actually, if you reach the stage 4, this type of skin does not sunburn, and 5 and 6 are the darker skin types. So every person, depending on his skin type, reacts differently to the sun. So for example, if you put a patient with the Fitzpatrick type 1 in the sun and another one with the Fitzpatrick type 4, the first one he would get sunburn. He would get a sunburn very rapidly, whereas the type 4 he would stay in the sun for a period of time, like a couple of hours before he gets sunburn.
So does the sunburn burns? Does they leave marks on the skin like the other types of burns?
If we are talking about first degree sunburn, no, it will not leave a mark. For the second
For
degree,
the hardest one, does it leave marks?
No, it will not leave marks. If it's just first degree, it will
So go
resolve.
through the sun.
No. No, this is not the appropriate advice, actually.
I'm just trying to get sure for myself. Okay, doctor, I think that we spoke about the sunlight and the sunburn. Now let's go to speak about burns in general. Always when we have some of the, when you go to the trauma unit, you will find some people are coming as a result of one of the fires that gets in their houses, and we have, by the end of the day, we have 3 degrees of the burns: first, second, third degrees of burns. What can you tell us about the differences between the 3 types of the burns?
Actually, for burns, like in sunburns, the same degrees apply. For example, now we just talked about the first degree sunburn. This also applies to the burn. For the second degree burns, usually you have more than the outer layer of the skin, which is affected more than redness. This is when we see clinically blisters or fluid-filled bulla, if you want, water-filled bulla, like balloons on the skin.
Yes.
And this is a more serious, definitely, condition than the first degree burn. The patient has very bad pain. He comes complaining of very bad pain at the site of the burn. And usually, if this area is manipulated, like if it is scratched, it can lead to infections, and this at the end point might be a cause of scarring, or it might lead to marks, as was your question before.
Yeah. So when we go with the levels for first, second, third, we are going with the harder cases, harder levels.
Yeah, that's true. But the first and the second degree burns, they usually affect just the skin. They are just limited to the skin. Whereas with the third degree burn, we have complete sloughing of the whole skin. So the whole skin is gone, and we can even see clinically the underneath layer, like the muscle, or even if it is more severe, we can reach deep down to the bone in the 4 degrees.
So for the severe burns, do we have, like now you know that because of the spreading of the high technology in most of the technical and the medical field, especially in this medical field, do we have something just to refill or to rebuild the cells again after having these burns?
Actually, we have, there are many new treatments coming out to treat these burns using like grafts. Actually, grafts are not a new treatment. Grafts are like when we take a piece of skin from another area of the body and we implant it on the area that is burned. But we have other types of treatments that are newer modalities. For example, when we take cells, we culture them and we try to make the whole tissue again, and then we try to implant the tissue. Yeah, these are new.
So this is something cosmetic, a little bit cosmetic, or
this is in the field of plastic surgery.
yeah,
true.
plastic surgery.
Not the
So
dermatology.
the point is still in my mind about the sun.
Actually, many people, they like to suntan, and this gives them a very beautiful color, but you have always to weigh the benefits and the risks.
Yeah, for here, I did not just know anybody speaking about the sun, but he's speaking about the bad effect of the sun. They're always complaining from the sun, but for now, till now, I did not hear anybody just taking the positive side of the sunlight. So now we are assuring the importance of having the sunlight of the morning. Like you have to take 15 minutes before 10 in the morning, before 10 a.m. and then some other 15 minutes before the dusk or before the Maghrib. But now, doctor, tell me, when we are obliged or when we are forced to go through the sunlight during these hard times, how can we prevent our bodies from being affected by the sunlight, this harsh?
We have many measures. The most important measure is to wear sunblock.
Wear some?
Sunblock or
Sunblock,
sunscreen.
yes.
Or sunscreen.
Yes.
These are creams or lotions that have a sun protection factor, and these they protect from the sun. They actually protect, some of them they protect from the UVB, which leads to cancer. Others they protect completely from the ultraviolet A and B. And we have to put these creams on our face or on the exposed areas like 15 minutes before we go out in the sun. Unfortunately, we have to keep applying these during the day if we are outside, so they would not last the whole day. But these are very effective in protecting. They can protect, depending on the sun protection factor, they can protect anywhere from 93% till almost 99%. This is a very important tool that we have. Another thing that is very important, we can wear wide-brimmed hats, and of course the sunglasses are also very important to protect our eyes also, because these are also affected by the sun.
Yes.
Try to always find some place to like above our
To
heads
cover,
yeah.
yes, or to protect our faces from having this direct facing with the sunlight.
I would like to mention also one thing is don't think that if you are in the car and there is the glass that you are protected.
Yeah.
Unfortunately, the glass would let the
Yes,
sun
the
rays
sunbeams
penetrate.
to go through the glass.
And so would still.
Yes. Doctor, so attracted to your speech, and let us go through another short report and going back to the sun and the sunlight. Let's go through this short report. Stay tuned with me, with my guest, Dr. Zenus Saleh. Waiting for you. Stay tuned.
summer season approaches, skin burns caused by excessive sunlight increase as well, where protection in its various forms becomes a #1 necessity. Whether caused by sunlight, heated instruments, or even radiation, skin burns can be one of the most painful injuries that most of us will have to endure at some point in life. An international classification of skin burns is set amongst doctors, pharmacists, and hospitals, making the treatment of skin injuries or burns easier and more efficient.
Burns have 3 stages. Okay, we can divide them into several categories. The first way to divide them is to say that there are first stage, second stage, and third stage. And there are also so many ways to categorize them. But the most technical way is to divide them by degrees. The first degree burn is the burn that evolved the first layer of the skin, which is the epidermis. And sometimes we can see redness and types of inflammation on the skin, and this is usually gone by its own after like 48 hours. And this type of burns is mainly caused by sunburns and sometimes contact with hot objects. However, the second degree burn is the burn that evolved the second layer of the skin, which is the dermis, and sometimes it can cause blisters, which is the types of sacs that contains fluid, sometimes blood, sometimes pus if it's infected. The third degree burn is the most severe types of burn. It can involve the bones, the muscle tissues, the blood vessels, and it's usually very severe. And mostly 90% of the times it's treated in the hospital.
The skin acts as a barrier against bacteria and viruses that inhabit the world outside our bodies, as our skin also plays a role in fluid and temperature regulation. And from here, the treatment of burns gains exquisite importance, considering the crucial anatomy of our skin, in addition to the aesthetics factors of scars after burns heal.
The treatment will differ between the different degrees of the burns. So, however, if we're gonna take the first degree, for instance, we can treat it at home. We can start by using cold water or tap cold water on the skin for approximately 10 minutes, and then we can use some kind of lotions and ointments. The second degree, by the way, is the most painful one, because the second degree is the level where you have your skin burned at an extent that the nerve are still there. However, the third degree, then most of your nerves are dead, so you can't feel pain. The cold water is important for the soothing and the cooling effect of the skin. And also we might, in some cases, if more than 10% of our body surface area is affected, we might need some kind of systemic antibiotic.
There are numerous old methods devised for burn wounds treatments. Some techniques involved ice, others used butter or even toothpaste. So are these methods effective, or are they just common fallacies?
It's misleading when we say that and it's actually unprofessional to put some kinds of, like we say, we put some toothpaste, and sometimes we put ice. However, the ice can cause some kind of can cause some damage to the surrounding unexposed or unburned skin. The toothpaste has no or very minor effect on the burn. Actually, what it does, it goes like a layer to protect the heat.
Stage 1 burn wounds caused by sunlight majorly are the most common skin burns and injuries to be seen, hitting the superficial layer of skin. These common burns can be often avoided through the right protection methods, whether through putting sunscreen lotions, wearing hats, and even not sitting too long in the sun.
The audio audience, welcome back after this report. We were talking about the sunlight and the skin diseases and some other factors that can affect our skin. With me in the studio, Dr. Zenus Saleh. She is a consultant dermatologist, and I'm so attracted to her speech about the disease and how to protect our skin and how to have healthy skin. Now, doctor, I have my last two questions because the time is running out so quickly with you, and I'm so happy because of this. My question now is to ask you about the sunburn. Do we have an effective sunburn treatment?
Time. Just leave it for time.
Just
If
time?
This is the most effective.
Come on.
Usually patients don't
Cannot
accept
depend on time.
Usually patients don't accept this, but usually the skin has its own ways to just calm down from the sunburn. If it is just a first degree sunburn, we can, as I told you, give the patient, offer them like cold compresses or to advise about how to stay in a cold environment, and then with time it will go on its own. We can also try the soothing lotions, the ones with the calamine, for example. These will calm down the itching. However, when it comes to second degree burn, time alone is not enough, because you have to make sure that with these blisters that we got, these should not become infected. So we may offer some topical antibiotics to prevent infection. Topical steroid creams, topical cortisone creams also may help calm down the redness. But of course, we have to watch out for the infection, for any infection.
Yes.
And educate the patient that if he sees anything worrisome like pus or something, come back to us. That's it.
What about the percentage here in Saudi Arabia? How is the percentage of the sunburned people? Do you have them in your clinic?
Usually they are not very frequent. Maybe here in Riyadh, because we don't have the beach. I'm sure if we move to Jeddah or some other place, we would see more. But we see people with the sunburns very frequently. For example, after the vacation time, or we saw many people coming back after Umrah during Ramadan. They had sunburns. So we see them. There is a factor that helps here, which is the skin type of the Saudi people. They are usually of the darker skin type, and this is why they are protected from the skin. The lighter skin you have, the less protected you are. So the skin type helps prevent sunburns. This is why we don't really see it here. We see the other diseases coming from sun, mostly like...
So who are the common segment of people that have the sunburn? Like kids, ladies, men? Do we have certain gender, certain segment of ages? And
if we are talking about Riyadh, usually men are more likely to get exposed to sun, because some of them, they have field work, and they are more likely to go out in the sun. But as I told you, since they have a darker skin type, they are protected. Kids are usually more likely to get affected. They have more sensitive skin.
yes.
But no, sunburns, they do affect all ages, at all times, definitely.
So now, as we've mentioned about the sunburns, and we also mentioned the other types of burns, okay, according to the fires or facing any other dangers that could be occurred, and also some of the electricity shocks. But now for the sunburn, because you know that we are here going schools, going to our offices to work, to do our stuff. Now, should we give a certain or serious, or does the sunburn requires a certain or serious medical attention?
It does, definitely. Especially when it is a second-degree burn, because it might lead to infections, as I told you.
Infections?
Yeah, and it might, even if it is manipulated, it might lead to scarring. With respect to the third-degree burn, it definitely needs medical attention, because here the skin is completely gone and the body is left without its protective layers.
Yes.
So second and third-degree burns should be seen by a doctor. If the first-degree burns, they are usually mild and they can be treated at home. But second and third, they do definitely need medical attention.
So I need you to just give a message to our audience, how to advise them for their kids, how to take care for the mothers, how to take care of their kids' skin, how to take care of their skin, because it's a very important thing to the lady to show with moisturized and a beautiful skin. And also for men to be protected, because they are going out more than the ladies. They are out all the day and during the sunny times. So how to tell them about the most important advice is to be protected from the sunlight or from the other types of burns.
I would like to say that the more you take care of your skin, the longer it will last for you in a good condition. It's like your teeth, for example. The more you brush them, the better they will stay, and the longer they will stay with you. So the skin is not less important than any other organ. It's of course very important to try to teach your child since his childhood to put moisturizers after a shower, because this is a good habit to keep the skin moisturized. Also
So please, I have to interrupt you right now. I know that you have a daughter.
Yes.
She's 3 months.
Yes.
3 months old. How can you take care of your little kid?
After shower on daily basis, I do put moisturizer for her. I watch out for any redness that's coming out on her face or on her body, and I immediately try to apply the treatment for her. Delaying the treatment would cause the condition to become more severe, and this might lead with time to problems that, like for example, would be like, for example, they would lead to eczema, and this would be more difficult to treat with time if you leave it. So watch out if you see any changes on the skin. Children should have a very soft skin. If you don't notice this, then there is a problem. Ask your doctor. He will be of help if you cannot yourself take care of the
And
skin.
you too. Thank you for your great help today. And give my kisses to your daughter. What's her name?
Yasmina.
Yasmina, give my kisses to Yasmina and take care of her skin. And I congratulate her to have such a mother, such a caring mother. Thank you, Dr. Zenus Saleh, the consultant dermatologist. And you, my audience, thank you for being patient to watch our episode today from Family Time. Our topic today was about the healthy skin care. Stay tuned with us till the next episode. Inshallah, it will be on next Wednesday. We will have a new topic that has the concern to the family affairs. Stay tuned. I'm so pleased to be with you today and to be with my guest, Dr. Zenus. See you next time, inshallah. And I have to say, Assalamu alaikum wa rahmatullah. Take care.